What's up, future respiratory therapists? In this video, we're talking all about compliance. Now, many of you this next summer are going to be starting your mechanical ventilation course, and you're going to need to understand compliance. There's two different ones. Let's dive in. All right, so as I stated in this video, we're talking about compliance. And as I stated also, there's two different ones. So we're going to start with dynamic compliance. Now, the word dynamic is very, very important here because the word dynamic means moving. It is what is happening within the lungs when gas flow is moving. Okay, that's what dynamic compliance is. Now, here's the formula for dynamic compliance. Tidal volume divided by PIP minus P. So you put a parentheses around these. You do this first. Basically, what it says when you're talking about compliance is the change in volume divided by the change in pressure. Now, we can just stop right there because the answer is going to be given in milliliters per centimeter of water pressure. And so milliliters refers to tidal volume, the amount of volume, and the centimeters of water pressure refers to your change in pressure. So when you see these numbers and you see them on perhaps in an exam or you calculate them yourself, it's like, well, what are the units of measurements? It's how much volume, how many milliliters are delivered per centimeter of water pressure. Okay? And so that's what that tells you. Now, when we talk about dynamic compliance, it gets pretty simple because we only need to consider what our PIP is. Okay? So we do have PEEP and we do have tidal volume, but the PIP right here is a very, very important part of this formula. You see, PIP, when the breath is delivered, the volume is going to go in. And as the volume goes, the pressure grows. And so as volume is delivered, pressure rises. And it will hit a peak inspiratory pressure point somewhere right there. This is your PIP. Now, PIP stands for peak inspiratory pressure. Peak inspiratory pressure. The highest pressure that was met during the delivery of this breath. Okay, so this is your PIP. Now, we started down here. Now, typically, you will be starting from a positive level, which is what we call PEEP, positive end expiratory pressure. So let's say that we gave a tidal volume here that was equal to 500 milliliters. Then to do this formula, what you would say is you would say, okay, 500 divided by our PIP. And let's say our PIP was 30 centimeters of water pressure. And let's say we're on a peak of 5 centimeters of water pressure. This is where we started, plus 5 over here, and then we come back to 5 down here. So what we would do is we would say, okay, 30 minus 5, we would do that first. So this is going to be 500 divided by 25 gives us a dynamic compliance of, I believe it's 20. Let's double check this. 500 divided by 25 gives us 20 milliliters per centimeters of water pressure. Okay? And so we see where that's how you do the formula. But let's actually step back here just for a second and let's talk about what dynamic compliance tells you. Because remember, we're going from PIP to PEEP. And the difference is what we're actually assessing here, okay? And so what would cause our PIPs to increase? Well, there's two different things during mechanical ventilation that will cause your peak inspiratory pressures to rise. It is an increase in airway resistance. That's number one. Number two would be a decrease in alveolar compliance. Now, when I say alveolar, it's very, very important that we understand what we're talking about when we talk about alveolar compliance. Now, Egan's, I think, does a great job. This is on page 231 out of chapter 11. It says, rule of thumb, the more compliant the lung, the less pressure needed to inflate it. The less compliant, i.e. stiffer the lung, the more pressure needed. And that's what you need to understand. As the lungs become stiff, it will require more pressure to deliver a tidal volume. As the lungs become more compliant or overly compliant, then you will be able to deliver that same amount of volume with much less pressure. That's what we're talking about. Now, we also talked about airway resistance right here, because what we understand is that airway resistance is also a mechanism that can affect our peak inspiratory pressure. If you have a very narrow endotracheal tube that you are pushing gas through at a very high flow rate, then you're going to have a higher airway resistance, and it is going to lead to a higher peak inspiratory pressure. So it's important to understand that when you're looking at dynamic compliance and we're just considering peak inspiratory pressure, that both of these elements will affect your dynamic compliance. Okay, that's very different than static compliance. Let's take a look at static compliance. Here's what we look at when we talk about static compliance. Now, the word static means still, not moving. So what's the difference between dynamic and static compliance? Well, dynamic compliance is the result of the peak inspiratory pressure while gas flow is moving. Static compliance, you have to do something extra to figure it out and to calculate it. You see, because the formula says here that to get static compliance, you have to do tidal volume divided by plateau minus peak. Well, what's a plateau pressure, Joe? Well, a plateau pressure is when you perform an inspiratory hold. Now, an inspiratory hold will take that breath that you just delivered, and it will say, at the end of this breath, I just want you to hold the pressure where it falls out. So what we see here is breath goes in. Remember, this was PIP. This is PIP. And then we say, okay, now hold. And you see a fall in that pressure. This is your plateau right here. And then we come back down to peak, okay? And so we started at peak. We increased up to PIP. We held the breath, and we got a plateau. This is the number we're looking for when calculating static compliance, because the definition of an inspiratory hold is when you hold the breath in the absence of flow. And so the breath is going. We hit our peak inspiratory pressure, and then we hold. Stop the movement. Just hold it and see what happens. And that's where we assess our plateau pressure. Now, let's say we put in a tidal volume of 500, and we get a plateau pressure of 20, and we started over here at a PEEP of 5. Then what we're going to see here is that we do the same thing. We do 500 divided by plateau, which is 20, minus our PEEP, which was 5. And you may say to yourself, well, why do we have to subtract PEEP? Like that, I don't think I understand why we're subtracting PEEP. Well, remember, compliance is change in volume. How much did we put in? Divided by change in pressure. You see, you have to put PEEP on here because we're starting at 5 centimeters of water pressure. So when our plateau is 20, there was only a change of 15. That's why we have to start with subtracting PEEP from our PIP during dynamic and from our plateau now during static. So now we do this math and we say, okay, well, what is 500 divided by 15? And we get approximately 33. Now, what are the units of measurements? Remember, tidal volume is milliliters pressure is centimeters per water pressure. So it's 33 mLs per centimeters of water pressure change. What that tells you is that for every 1 centimeter of water pressure, we were able to deliver 33 milliliters. Now, Egan's talks about this, page 1153. It says normal compliance, specifically talking about static compliance, ranges from 60 to 100 milliliters per centimeters of water pressure. And that's in reference to the lung parenchyma. Now, this is what's important here, okay? Is that when we look at this and we see what we're learning, what we're seeing right here with static compliance, is remember the PIP is up here. Or remember, PIP was a result of airway resistance and compliance. But when we look at plateau, this tells us all about alveolar compliance. Just alveolar compliance. Very, very important to realize that plateau pressures talk to you about the integrity of the alveoli. You see, there's no airway resistance in this assessment because there's no gas moving. So when gas becomes ceased and still, then airway resistance is now removed from this formula. So if you want to know the integrity of your alveoli, then you're coming down here and looking at static compliance. And you're going to use your plateau pressure as your indicator for such. Okay? Now, that may leave you just a little bit like, well, so what's the difference? Like, well, what are we talking about here? Well, let me show you this image. You see, when we compare the two, we see two pressure waveforms here. And what we understand is that PIP, peak inspiratory pressure, will always be greater than plateau during mechanical ventilation. It has to be because the PIP is the highest pressure, and then when we stop flow, we drop down to a plateau pressure during volume control ventilation. So what we see here is like, look, here's our PIP up here. This is our PIP, and here's our plateau. The difference between these two is your airway resistance. It's very, very important to understand this. The difference between these two is your airway resistance. So when we look at this compared to this image over here, we have our PIP here, we have our plateau here. What about the difference between the two? This is our airway resistance still, but it's much smaller here than what it is here. So the question you have to ask yourself is why are my peak inspiratory pressures so high? Two things can cause them to go up, which will cause my dynamic compliance to be decreased. Remember, it can be airway resistance, or it can be the alveolar compliance or the integrity of the alveoli. So what we see here is that why is this peak inspiratory pressure elevated? Well, it's not elevated because the alveolar compliance has stiffened. It has gotten worse. No, this PIP is elevated because we have an airway resistance problem. You see, this situation is the result of asthma, maybe secretions, maybe a patient who is biting on the endotracheal tube. Perhaps you have an endotracheal tube that is too small for your patient. Those are airway resistance problems. You're probably going to have to treat those. If it's bronchospasm, if you see this and you have expiratory wheezing, you should probably give a bronchodilator. If you have this and you have coarse crackles, you should probably suction the patient. If you have this and you recognize that the patient is agitated and biting on the endotracheal tube, then you should probably treat the patient and maybe insert a bite block. You see, these are airway resistance problems. But when we get over here, why is our peak inspiratory pressure elevated? because the plateau has pushed it up. You see, the plateau didn't push this PIP up. The airway resistance did. But over here, the plateau has increased the PIP. Well, what does plateau tell us? Alveolar integrity. So, what does that mean? That means that the stiffening of the alveoli has pushed up the plateau, which is also causing your inspiratory pressure to be higher. And what are we talking about when we talk about alveolar compliance and alveolar integrity? Well, what we're talking about are things like fibrosis, specifically pulmonary fibrosis. We're also talking about things like pneumonia, maybe things like a pneumothorax. Those are all elements that are affecting the alveoli. We could put here atelectasis. Atelectasis will cause your static compliance to go down because it will push your plateaus up because you have unhealthy alveoli that have now collapsed. The other thing that can cause this is a decrease in chest wall compliance. And so we see where when we see a rising plateau, we have to ask ourselves, what is going on with our alveoli that we need to help recruit more functional and healthy alveoli, because they are either collapsed or filled with fluid or fibrotic, or you have a non-compliant chest wall. That's pretty much where you are when it comes to that. Now, this is what it looks like when you're able to look at your pressure waveforms, okay? Where you can see your pressures and you're doing an inspiratory hold and you're going, oh, look, PIP's way up here and Plat's way down here. I know that's airway resistance. Or PIP's way up here and plateau's way up here. That's alveolar problems. Okay, I can see it. I can visualize it. But let me give all you students a tip here when you're taking your exam. Here's the exam tips. We're going to wrap up right here. Look what we have here, because you're not always given these waveforms to be able to assess this with, okay? But you now know what the waveforms look like. A big drop between PIP and plateau means an increase in airway resistance. A little drop, both of them elevated, means you have a worsening alveolar compliance issue that you have to assess. So, but again, we don't always get that, right? And so what am I supposed to do when they give me a bunch of numbers? Well, let's look at it. Tidal volume of 500. Tidal volume 500. Peak inspiratory pressure. Remember, we called this PIP. 50 centimeters of water pressure. Over here, 50 centimeters of water pressure. So right now you look at this and you go, oh, both these patients are the same. There's no difference between them. Let's hold on just a second. Look at our plateau pressure, 25 centimeters of water pressure. But over here, 45 centimeters of water pressure, and our PEEP is 5 centimeters, and our PEEP is 5 centimeters of water pressure. Now, what's the difference between these two scenarios? If you want to, pause this video and say, what do you think is going on here? What do you think is going on here? Now, here's the breakdown of it, okay? Remember, when you look at PIP and plateau, if you ever see a large difference between them, okay, a large difference between your PIP and your plateau, this is your peak inspiratory pressure versus your plateau pressure, then you're looking at an airway resistance problem. You see, your plateau pressure is 25 centimeters of water pressure. That's good. We're okay with that. But you have a very high PIP. You know what the problem is here? The difference here being 25 tells you that you're dealing with an airway resistance problem. Now, we look on this side. Look at the difference here. The difference between these two is just 5. That's a very small difference. So why are our PIPs 50? Because our alveoli are non-compliant, evident by our plateau pressure. This is an alveolar compliance problem. This patient has a developing pneumonia, has a pneumothorax, maybe is right main stemmed, maybe is a burn patient with a very stiff chest wall, maybe they are severely atelectatic. That's this patient. This patient, airway resistance, secretions, bronchospasm, biting on the endotracheal tube, perhaps an excessively small endotracheal tube. Now you look at this and you go, okay, big difference, small difference. Big difference, small difference. Here's the image. Big difference. Big difference, small difference. Compliance, alveolar, airway resistance. That's the game. That's how you tell the difference between these two. So, as I wrap up here, I want to tell you about my free cheat sheet course. This is basically called my Respiratory Coach Free Resources. This is a completely free course that you can access on through my Respiratory Coach Academy. There's a link in the description below. Check it out and go sign up for that course right there. All kinds of stuff over waveforms related to what we just talked about, all kinds of stuff in that program right there. Also have my 2 boot camps right here. The TMC boot camp to help you pass that TMC exam on the first attempt. It's right here. And then once you pass that, you can take the CSC boot camp to help you pass this clinical simulation exam on the first attempt. And then 2 extra little bonus courses here, pharmacology and ABG interpretation. If you're interested in any of those, they're there to aid your educational experience and just be a resource for you to have so that it doesn't have to be so hard. Hey, that's compliance. I'm a respiratory coach. Here we are on YouTube. Do me a favor, hit the like button, subscribe, leave me a comment. I'd love to hear from you. Also, come follow me on Instagram and TikTok at Respiratory Coach, LinkedIn at Joe Lewis, and then send me an email, respiratorycoach@gmail.com. I'd love to hear your thoughts on this video and just continue the conversation with you to answer any questions or concerns that you may have to help you better understand this complicated conversation of dynamic and static compliance. Remember, at the end of the day, average is easy. Don't be it.